How can you tell if it's the nerve root or piriformis syndrome?
The nerve root exits via the lumbar intervertebral foramen. That lumbar radiculopathy, what we're typically looking at are those nerves coming out of the back. Typically the lumbar radiculopathy, what you'll see is myotomal weakness or fatigable weakness. And then when we're talking about the peripheral nerve, we're looking more at after those nerves come together and go down the leg. L4, we'll be looking at that weakness with dorsiflexion. If we talk about L5, we'll be looking at weakness with that big toe extension. And then when we look at reflexes, always compared to the other side, is there a weak reflex at the knee, weak reflex at the calf, as well as dermatomes. So going down the legs in those specific dermatomal regions, so patterns of sensation related to specific nerve roots, and seeing if there's altered sensation. We could also look at the movements of the back. So when we have the patient bend forward or extend, what we'll typically see is that some movements onset their pain. If we go to peripheral nerve, piriformis presentation, we might look at, does the hip movement affect how they present and their onset of pain? We would also likely see more general weakness. So it's that entire sciatic nerve that's being compressed. We might see a combination of hamstring, calf, dorsiflexion weakness altogether. And then lastly, reflexes would be intact. And we could also test that isometric internal rotation, internally rotate the hip. And if that recreates the pain, there's no movement happening at the back, but there is a muscle contracting, putting pressure on the nerve.